Hey everyone, welcome back to my channel. If you're new here, my name is Sandra and I'm a nurse practitioner, and today's video is going to be all about fever in children. So my child has a fever. That's probably the #1 complaint we see in the emergency room during the winter months. There are just so many viruses that pass from kid to kid, sibling to sibling, and sooner or later, your child is probably going to end up with a fever too. So anytime a fever occurs in a child, it can cause a lot of panic and confusion for the parents or the caregiver. And even for myself, my toddler recently had a fever and my immediate mom brain started to get all this anxiety about, oh no, why does my child have a fever? But then my nurse practitioner brain and my experienced brain dealing with thousands of kids with fevers jumped in and took over. I have to remember to keep it real and remember what I tell my patients. And this is what I'm going to talk about with you guys today, because if I'm even feeling anxiety when my child has a fever, then I know most parents are feeling the same thing as well. So I just thought, since we're in the thick of virus season, that it would be a good time to review fever in children and how to manage it if your child gets a fever. Okay, so what is a fever? So a fever is a natural response by the body to fight infection. When the body temperature rises, that makes it more difficult for infections to grow and spread. And so it's a very natural response. So the body has an internal thermostat, which is regulated by the hypothalamus in the brain. The average body temperature is 98.6 Fahrenheit, but the normal general body temperature range can be from 97 Fahrenheit to 99 Fahrenheit. So there is fluctuation in your own body temperature even throughout a normal day. So when a fever occurs, the body temperature rises above 100.4. And often in kids, we will see temperatures of 103, 104, 105 Fahrenheit. And this is not uncommon with kids. So fever itself is not an illness. It's a response to some other cause, usually caused by an infection of some sort, most often a virus. So during the colder months, it's a lot easier for these viruses to travel. And that's why we see this increase in flu and colds and viruses. So the fever is a very natural, healthy response by the body to fight infection. Okay, so this video is going to apply to children that are over 3 months. If your child or infant is 3 months or younger and they have a fever of 100.4 or greater, they need to be seen by a medical provider or go to the emergency room as soon as possible. When an infant is 3 months or less, they are at a much greater risk of developing some very serious infections, which are usually caused by bacteria acquired from the mother during a vaginal birth. Some of these infections are from group strep B. That's why pregnant women are usually screened for this prior to delivering. Also, herpes simplex virus can be very serious if an infant catches this. And so if your child is 3 months or less and has a fever, call your doctor right away, take them to an emergency room. They need to be evaluated as soon as possible. So once a child is older than 3 months, that risk for a bacterial infection or a serious infection significantly decreases, and therefore these children don't need to be rushed to an emergency room for a fever. The little babies less than 3 months will get blood work, chest x-rays, lumbar puncture, and this is just not necessary in children over 3 months because the risk of those serious infections is significantly reduced after this age. Okay, but if your child is 3 months or older and develops a fever, and often the fever will start in the middle of the night, and as with my toddler, it was 2 in the morning, he started to look very flushed, his skin was hot, and so I checked his temperature and it was 104 Fahrenheit. Don't pay so much attention to the number. Some kids can get really high fevers, and that's very common in the beginning of an illness, but take a look at your child and see how they appear. Are they having any distress? Are they having trouble breathing? If your child is sleeping and has a fever, but they appear comfortable and breathing normally, there is no need to wake them up. If your child has a fever when they are awake, you want to look at them, and if they are alert, smiling, interactive, if they are playing with their toys, running around, then the fever is probably not caused by a serious illness. If they are eating and drinking, when kids are sick, just like us adults, they're not going to want to eat as much, but as long as they're drinking fluids and keeping them down and making normal wet diapers, or if the child is older, urinating or going pee as normal, that is a good sign. If your child has an overall normal skin color, when they have a fever, they may have flushed cheeks, but doesn't have any odd coloring like purple or bluing or severe paleness. They don't have a rash. There's no distress of breathing or no specific distress related to their ear or their throat. You don't see any pulling at their ear or grabbing at their mouth or their throat. They appear well and normal when their temperature comes down, and they're not having any vomiting or diarrhea. So if this is your child, they have a fever, but they don't have any of these other symptoms, then it is most likely not caused by anything serious. So you're going to want to check with your pediatrician if your child has a fever of 102 or higher and has any of these following symptoms. So refusing to drink fluids or just too sick to keep fluids down or take enough in, has had multiple or prolonged episodes of vomiting or diarrhea, is having any signs of dehydration, so not making tears, not urinating or going pee as much as normal, or if they seem less active or less alert, that can be a sign of dehydration. If they've had a fever for more than 2 to 3 days, if the fever is staying high after 3 to 4 days, so in children 2 and younger, the fever should start to improve within 24 hours. In older children, it could take up to 72 hours to start to see an improvement, but that fever should be gradually trending down over the days. If the child has a specific complaint, such as ear pain, or if they're too young to talk, they're pulling at their ear, they're grabbing at their ear, if they have a sore throat, or again, if they're too young to talk, they're just grabbing at their mouth, trying to get in their mouth, that could be caused by a specific infection in the mouth, and that should be looked at by a medical provider. If your child is getting a lot of repeated fevers, such as every week, that is definitely a concern. If they have any rash accompanying the fever, if they are complaining of pain when they go pee, or if they just seem uncomfortable when they're urinating, if they have foul smelling urine, cloudy urine, that is a concern. Or if they have any chronic medical conditions such as heart disease, cancer, lupus, sickle cell, any chronic medical condition puts them at a higher risk for a serious illness if they develop a fever. So your pediatrician will definitely want to know about this fever. So if your child has a fever of 102 Fahrenheit and they're having any of these symptoms, it's definitely something you should touch base with your pediatrician or your primary doctor so that they are aware and they can advise the next steps. So if your child is having any of these next symptoms accompanied by the fever, you want to get them evaluated right away, take them to an emergency room, and have them looked at by a medical provider. So if the child with a fever is having extreme irritability, crying, you cannot console them. If they're extremely irritable or fussy, if they are just limp and they're refusing to move, if the child appears listless or just not having good eye contact, if they appear lethargic, sluggish, difficult to wake up, then that is definitely a concern and they should be taken to an emergency room. If they have a rash that looks like bruising or purple spots that weren't there before your child got sick, if they're having any bluing of the lips, of the tongue, of their fingers, or if they have a very pale or blue appearance overall, if your infant is still young enough to have soft spots and they are bulging outward or they are pulling inward, that can be a serious sign and you want to have them evaluated. If they're having a stiff neck, any neck pain, or they can't bring their chin down to their chest, or just any trouble at all moving their head or neck. If they have a severe headache, if they are having severe drooling that they don't normally have, or if they can't swallow their own saliva, if they're having any distress or trouble breathing. So in babies and children, when they are having difficulty breathing, you will see their little noses start to flare. You will see retractions, which is when they are trying to take a deep breath and it's pulling so hard on the skin around their chest or on the abdomen that you can see it coiling inward. If you see pulling around the trachea, this indicates a child is having a really difficult time getting air and they need to be evaluated. This is an emergency situation. If they seem to be leaning forward, which we call the tripod position, that is also a sign that they are just not getting the air they need to breathe. If they've had any seizure activity or convulsions greater than 5 minutes. Fevers can definitely cause seizures in children from ages 6 months up to 5 years, and we call these febrile seizures. Or if they're having any moderate to severe belly pain, especially if it's in a specific region. So if your child is having any of these symptoms, you want to get them to an emergency room right away to have them evaluated. If your child appears comfortable, not having any distress, they look relatively well, then it is likely not an emergency and you don't need to rush to the emergency room. You can touch base with your pediatrician in the morning or the next day, but unless they have any severe distress or any of the symptoms I talked about here, then it's likely not an emergency situation. So the great majority of fever in children is caused by viruses. And that will often be accompanied by runny nose, sneezing, coughing, congestion. So these symptoms, along with the fever, are just going to have to run its course, which is typically in the 5 to 7 day range, but they can last up to 10 to 14 days. So as long as there is a gradual improvement in symptoms, that's a reassuring sign. There are no antibiotics for viruses, they just have to run its course. So how do you help a child get through the fever, get through this viral illness? So some kids can have a temperature of 102 and they are playing and interacting as normal. And typically the higher the fever goes, the more uncomfortable the child starts to feel. So if the temperature is in the range of 104, 105, the child will start to appear more irritable, more uncomfortable. And so that's when it's a good idea to start doing some intervention. So you could try to bring the fever down with some lukewarm compresses. Just wet a washcloth with some lukewarm water and pat down the skin. And as the water evaporates, that will help cool the body. Also, if your child has a high fever, you're going to want to undress them, get off any sweatpants, heavy clothing, just have them lounge around in a t-shirt or even a diaper. And that will help get rid of some of that excess heat as well. So do you need to use medication for a fever? No, you do not. If your child doesn't appear uncomfortable, is still tolerating fluids, then there is no need to give any medication to help bring a fever down. The fever is actually a good response and it helps fight off the infection. And now in most cases, healthcare providers are going to tell you to let your child ride the fever out if they're not so uncomfortable. But if your child does appear uncomfortable or they don't want to eat or drink, then it's probably a good idea to give them some children's Tylenol or Motrin to help them feel more comfortable as they get through this illness. You definitely do not have to give it around the clock every 4 to 6 hours. That's not even advised anymore, so you only want to give it when it's necessary. You never want to give a child aspirin, which can cause Ray's syndrome, which is a rare but serious condition. Okay, so the medications you can give to a child for fever is either children's Tylenol or children's Motrin. Both of these medications should be given based on the child's weight, not on their age. And if you're at home with a child less than 3 months, you want to get them evaluated by a medical provider or to an emergency room as soon as possible. So do not give Tylenol to a child less than 3 months before they are seen by a doctor or a medical provider. So I just want to talk about these medications separately and tell you everything you need to know. Ibuprofen is the generic name. Motrin and Advil are the brand names. So you can often get the generic medication cheaper and it's the exact same medication. So children's ibuprofen or Motrin comes in a concentration of 100 milligrams per 5 milliliters. And so if you come to the emergency room, we're going to weigh your child in kilograms, and the dose of ibuprofen for children is 10 milligrams per kilogram every 6 to 8 hours. So a Motrin should not be given to a child less than 6 months because their kidneys are not fully developed yet, and this is excreted by the kidneys. If you're giving this at home, there is some general guidelines for the amount to give based on the weight. But ideally, the child should get the dose based on their accurate weight. Okay, and then the other medication you can give to children for fever is Tylenol. So Tylenol is the brand name, but acetaminophen is the generic name, and there are many generic brands of acetaminophen that work the same. And it comes in infant's Tylenol and children's Tylenol. And what is the difference between infant's Tylenol and children's Tylenol? Absolutely nothing. The concentration is exactly the same, the medication exactly the same. The difference is you are going to pay 3 times the price for infant's Tylenol as you will for children's Tylenol, which is the exact same medication. So how did this price difference come to be then? Well, prior to 2011, the infant's Tylenol was much more concentrated, and therefore you were getting more medication in the bottle. I believe the dose was 80 milligrams per 0.8 milliliters. But some infants were receiving too much medication or were accidentally being overdosed, and this was causing toxicity in children, liver failure, and some children actually died. And so back in 2011, they standardized the concentration across infants and children's. But the price of infant's Tylenol still remains 3 times that of children's Tylenol. And when the company Johnson & Johnson was asked about this, they explained that with the infant's Tylenol, you receive a syringe to dose, as opposed to a measuring cup, which is included in the children's Tylenol box. Also, they say that the bottle itself is more sturdy. There is absolutely no difference in the medication of children's Tylenol and infant's Tylenol. Okay, so here we have infant's Tylenol. This is a 2-ounce bottle, and the concentration, as you can see, is 160 milligrams per 5 milliliters. So this infant's Tylenol is listed at $4.40 per ounce. Okay, and then here we have another box of infant's Tylenol, but this comes in a 1-ounce bottle. And as you can see, the concentration is the same, 160 milligrams per 5 milliliters. And the price of this infant's Tylenol is $5.99 per ounce. So almost $6 per ounce. Okay, and then finally we have here children's Tylenol. Again, the concentration is the same, 160 milligrams per 5 milliliters. But this Tylenol is listed at $1.57 per ounce, which is an extreme difference in comparison to the infant's Tylenol. It is the exact same medication, so don't overpay for children's Tylenol. So how do you know a child is responding to the medication? Look at the child. Do they look better? Are they more playful? Are they more interactive? Are they eating and drinking? Take a look at the child. If there is an improvement, they are likely feeling a lot better. If they don't appear flushed or their skin temperature doesn't feel hot anymore, then they are likely feeling a lot better, and a repeat temperature check is not necessary. At a clinic or the emergency room, children less than a year old are likely going to get a rectal temperature check, which is the most accurate. But at home, these digital type thermometers are very common. This one, you just check on the forehead right here and you'll get your reading like that. 98.1. There's also the tympanic thermometers, which go in the ear. You can do oral, which is under the tongue, or you can do axillary, which is under the arm. So for these viral illnesses, supportive care is most important. There's no antibiotics to treat them. They just have to run its course. And therefore, supportive care is very important. So this includes keeping the child comfortable, letting them rest or take extra naps as needed. If your child is breastfeeding, let them breastfeed even more than normal, because that is going to help them fight off the illness even faster. Making sure they're drinking fluids, water, Pedialyte are ideal. Their little bodies can get dehydrated so quickly, especially if they're vomiting or having diarrhea. That can deplete fluids from their bodies much more quickly. So make sure you are offering fluids throughout the day. If they don't pee or have a wet diaper in a 6-hour window, then definitely take them in for a medical evaluation at an urgent care or an emergency room. And kids are just not going to want to eat as much as normal when they're ill. Just like adults, we don't have an appetite when we're sick, neither do kids. So as long as they're drinking and keeping the fluids down, that is the main concern, and we just don't want them to get dehydrated. So you don't want to give sports drinks to a child. They have a lot of sugar in them, and they can actually make diarrhea worse in children. Give Tylenol or Motrin as needed to help with comfort. You don't have to medicate the child if they appear comfortable. The way your child is acting is much more important than a reading on a thermometer. How is your child looking and acting? Closely observe for any changes, especially going in the opposite direction of recovery, and notify your doctor or pediatrician. Lots of snuggles, lots of cuddles, and your child should be on the road to recovery. So fevers are very common among children. They usually bounce back very quickly within a few days. If you're ever in doubt or just unsure about what to do with your child's fever, do touch base with your pediatrician, your doctor, or visit an urgent care or an emergency room. It's best to keep a child home from school or daycare when they have a fever, and they shouldn't return until their temperature has been normal for at least 24 hours. All right, you guys, so I hope you enjoyed this educational video. If you have any questions or comments, please leave them down below. If you like this video or you found it helpful, please give it a thumbs up. Please share it with someone who you think might benefit from it. Please don't forget to subscribe to my channel and hit the notification bell so you get all my new videos as soon as they go out. All right, you guys, thank you so much for watching, and I will see you in my next video.